Well, tonight we examine the impact the COVID-19 pandemic is having on cancer patients, as well as cancer diagnoses, as annual screenings for many types of cancer have been delayed due to coronavirus concerns. And joining me now on Skype to help us do that is Dr. Felix Rodriguez, a medical oncologist, hematologist. He's also a member of the Catholic Medical Association. Doctor, welcome. Thank you very much.
Thank you for having me tonight, Owen.
Let's get right to it. COVID-19, pretty much it's killed or sickened millions across the globe. How has it impacted cancer patients and their screenings?
Well, it started impacting us immediately when we started the lockdowns. Here in Florida, we immediately saw the follow-up appointments go down. People were very scared to even come into the office. We had to even start doing telemedicine.
What do you tell folks scared to come into the office?
Well, we are actually screening them as they go in, and we reassure them that for those patients that need to be seen for chemotherapy or for blood work, that we are taking the measures using protective equipment and also doing the necessary cleaning so that the safety of their care is assured.
What is your major concern as an oncologist and a hematologist? If people aren't going in, if the screenings are weighed down, are you going to see 2 months from now, 5 months from now, a year from now, more people coming in with very serious conditions?
That may be the case. So one of the things that we're trying to educate our patients about is that now as the lockdown is starting to be eased up, those screening procedures that were being put on hold, like mammograms and colonoscopies, that they're going to start being done. So we don't want them to delay on the care that they need so that they find these cancers earlier and we can start treatment so that they can be assured their survival.
So the main thing is you have to build confidence in those patients, it sounds like, to even just physically enter the building.
Yeah, that is correct. And one of the things that we've been seeing is that even now they're being afraid to go into the emergency room. I get calls all the time. No, I don't want to take my husband to the ER because he is going to get sick there. Mm-hmm. But then they end up being more sick when they arrive later.
Telemedicine, we've seen it being used more and more now. Is it, in the terms of your cancer practice, is it effective or not?
It has become effective. For instance, for those patients that don't need to be seen because it's basically to go over medications, to go over lab results, test results, it's released part of the stress that they feel for coming into the office. And they're liking it. At the beginning, it was a learning curve. It's still a learning curve, but we've been able to accomplish what we need through it.
On a more of a personal note, as a Catholic physician, how does your faith, if I may ask, how does it help guide you, especially during these very difficult, uncertain times?
Well, one of the things that I've been doing every day as I leave my home is I've been using podcasts, some of which are from EWTN. I start my day with Morning Glory, and I like to pretty much continue in prayer on my way to work, and that really settles me down. And I remember that prayer as the day goes by. It has been a source of strengthening.
Well said, and best of luck to you. Dr. Felix Rodriguez, thank you very much.
You're welcome. Thank you again for having me.